afternoon. Good afternoon to everybody, and welcome to the 38th Flint Community webinar on coronavirus, sponsored by the Healthy Flint Research Coordinating Center here in Flint. And I'm so happy today to be your moderator, Yvonne Lewis, as a co-director of the Community Core of the Healthy Flint Research Coordinating Center. I'm just amazed every week when I look up and I say, we've passed another week, and now here we are in December. And we want to appreciate you for joining us for these 38 weeks and all of our partners. As you can see here, that we have partners from all across the city and the county, as well as state representation for this webinar, because our goal was to bring to you, when we started this 38 weeks ago, to bring to you information that was relevant to our community regarding the coronavirus. We wanted to be sure that those of us here in this community had an opportunity to understand what resources were available and just how we would share those resources with others in our community. I am excited today because you have been so engaging with us. And so we've added a couple of things today that we hope you will benefit from and that you would enjoy. Today, we have a little bit different format. We have the Flint Community COVID Roundtable. And as you can see, we have some wonderful guests that are going to be here with us to sit around the table today. That is Isaiah Oliver from the Greater Community Foundation of Greater Flint, Dr. Susan Woolford from the University of Michigan in Ann Arbor, and Dr. Deborah Froh-Holden, who is also from the Michigan State University here. Now, Dr. Froh-Holden and Susan Woolford are also co-directors of the Healthy Flint Research Coordinating Center. We did have scheduled with us Dr. Larry Reynolds, but Dr. Lawrence Reynolds has been called away to a very important meeting that I'm sure all of us are going to want to know more about in the future, and that is the COVID vaccines for our community. So we also have Suzanne Kupel from the Health Department, Genesee County Health Department, that will join us for this roundtable. But before we get to the roundtable, there's another element we've added, and that's what's in the queue. When we talk about what's in the queue meaning question, and our question and answer segment, you've given us some questions either in the queue right here in the webinar, or you have given us questions through our info@healthyflint.org, or you've even called us. And so we want to just give you an update to let you know we've heard you and we do hear you. And we're going to be adding this segment to let you know what we've heard. Our team will monitor this site on a regular basis. So here's what we heard that's in the queue. And I want our team to be ready to talk about this. Reopening the state and the country, self-quarantining at home, mental health resources, and vaccines for COVID-19. Little tip on that in a moment. We also have received some very specific questions, and all of these we're not going to be able to answer today, but we want you to know again that we're paying attention. There's questions about the diet people should be on as it relates to how they can be assisted during quarantine, having a great diet. Have people with health conditions been involved in clinical trials, and how will the vaccines affect them? And what are some of the safety concerns about vaccines, the temporary side effects, and even the projections on when these will be available in our community? These are conversations that we're going to be having in the upcoming weeks. So today, again, I want to welcome my panel, and I'm going to ask them to unmute themselves. Our panel is here, and I want you to see who they are today. Dr. Deborah Froh-Holden, Gary Jones, and do I see Isaiah Oliver has made it to be with us yet? All right, and Dr. Susan Woolford. So we had a conversation last week, and unfortunately, the two of the persons that were in this conversation are not here, but I'm going to pose this question to our panel here. Obviously, people are concerned about what's coming next. And we talked last week about how we would be more able to acknowledge, as public health officials, community and organizational leaders, how are we acknowledging we're really dealing with this virus? Dr. Deborah, would you start us out on that conversation? What's the real deal? Now, this real talk. You know, we've been our professional Dr. Deborah Froh-Holden, and of course, this wonderful voice of Dr. Woolford. But how are you really dealing with this?
I'm 8 ways in the struggle. I'm not even gonna lie. And I'm the epidemiologist, and People love this. I got to drink the same Kool-Aid I'm serving. I didn't get to spend Thanksgiving the way I wanted to spend it with my family in Baltimore and in DC. I was here. It was really small. I'm dealing with a lot of health challenges in my division at MSU. It's just a humble reminder that even though we've got this pandemic, that life is still happening. People are getting sick. People are developing hypertension, diabetes. I've had 3 women in my department now diagnosed with breast cancer. It's a lot. I feel like the weight of all of it in the face of all of the social and the physical isolation is tough. And then I heard, which I'm really grateful for, President-elect Biden said that he is going to issue a 100-day national mask mandate. And I thought, so that's going to be coming January 20th. So it's 100 days from that. I'm assuming there's going to be more that's going to come with that. And as much as I advocate for a national strategy with stay-at-home orders and provisions for people, I also think, gosh, like another 100 days from January 20th minimally. It just feels like, is there a real end in sight? That's sort of,
Yeah.
and that's like Debbie. That's Debbie talking. So Dr. Deb knows what we need to do, but the human in me is getting drained. I'm wearing.
So Dr. W, that's the point that Isaiah made. And last week, he just got a lot of hand claps and kudos because he just raises flat out, this is a real issue. And we think about it in community. People aren't thinking about all this data and the epi and the science part of it, but the emotional part of it. And I wonder, Dr. Susan, in your experience at the hospital, when you're seeing patients every day, so from that perspective, how are we dealing with this?
Well, interestingly, I actually think in some ways we're seeing, like, I see better compliance with masks now than I saw 2 months ago. Somehow people are beginning to hear the message. It's beginning to get through that this isn't going away, when the seasons change, that this isn't going to be just a brief thing, and that actually wearing masks makes a difference. And so while it is incredibly hard, and I'm certainly seeing a lot more stress and a lot more anxiety in the children that we see from very young children. I had a parent last week who was speaking about her, I think it was a 4-year-old, who started to sort of really have a lot of conversations about death. And she said, well, nobody's died recently in their family. So she wasn't exactly sure why this child was beginning to obsess around death. And then she decided, it probably is about all of the news that she's hearing about COVID-19 and the many deaths. And so this is causing a lot of stress for people of all ages. And that increases the difficulty. So I do think from a medical standpoint, it is incredibly challenging. On a personal standpoint, it's incredibly challenging. Just before this webinar started, I opened the door to get a package, which most people will say, that's a good thing you got a package. But it was, my parents mailed me my holiday gift that just arrived, which is new because this will be the first year. And I'm 100 years old. This will be the first year that we were not together for the holidays.
Yeah.
And I mean, that's a little thing compared to what people are really dealing with, but just to show that it's on the personal side, it is on the institutional side. This is a very, it's such a difficult problem. And I think one of the ways that we can deal with it maybe a little better is realizing that there are things that we can do consistently to get us through what is probably going to be a long haul.
Thank you. Dr. Deborah, I want to come back to you, but I also I see Katie Baxter is with us, and she's from the Genesee Health Systems, and she's done some conversations with us on mental health. And I asked her to come on and just to answer questions in the queue, but you raised something that I wanted to respond to as far as how mental health is affecting our children and then these upcoming days. But while you're thinking about that, Katie, I want to just pop back to Dr. Deborah. And you said this is Debbie today talking. So, but last week you raised this issue about being in the bubble, this social, we talked about being the social pods. And when Dr. Wolford said we can't really get out and be with our families, it reminded me of that conversation. So before we have Katie come on and talk to us a bit about how we can kind of get our heads wrapped around some of these issues from a mental health perspective, really explain to us what is this social pod thing? Yeah, we are coming up with these new terms, and tell us what this really means.
No, but you know what I think is so funny is uh, very few people in my family understood what kind of doctor I was before COVID. They would say things like, I got this back pain or this skin rash. Can you get me some so-and-so cream? Or can you get me some? I said, I'm not that kind of doctor. I'm an epidemiologist. What do you do? I study epidemics. What's that? I study disease outbreaks. Guess what? Now everybody knows what an epidemiologist is.
Yeah.
Right? And everybody knows what
Yeah.
an epidemic is and a pandemic. So, you know, let's all roll up our sleeves and put on our thinking caps because we're learning a lot. And these notion of social pods, this is, I mean, I wouldn't wish a pandemic on any society, but these ideas I think will help us not just in this pandemic, but in the future. We should all be better equipped. So basically, the basic thinking is a social pod is a core group of friends and family who come together and agree to limit their in-person social activities to only each other. You practice physical distancing with anybody that's outside of that group. And the whole point is that if you can create these social pods, it's like, you know, think of the movie, the bird, what was it called? The Bird Box?
Bird cage, Bird Box.
Bird
Yeah,
Box.
yeah. Bird Box.
Bird Box, where, you know, once they were in a house together, really didn't want to let other people, you know, in the house. Why? Because they weren't sure of the status of the people who were outside, right? Because in the Bird Box, people who were outside who looked at whatever that thing was, you know, became crazed, right? And so the thinking is that anybody outside of your social pod potentially is not honoring the protocols, potentially is not in the same agreements. The whole point of creating a social pod is that you then have real talk, upfront conversations about what you will do and what you won't do. So a lot of times people in social pods, you might have somebody in a social pod that is working. So let's look in your household, Yvonne. Your daughter's working in the home. You've had to work outside of the home. You had an exposure. You were getting your meal delivered to your room. Once it was identified,
don't come out.
Exposure, you then alerted the other people in your household, i.e. in your social pod, and you were physically distant for a week, got tested, got your test results back, etc. So if you had, you know, two social pods operating that way, the thinking is with everybody honoring the protocols, honoring the agreements that they've made, you could actually bring two of those pods together in numbers 10 or less for like a Thanksgiving gathering or a Christmas gathering. But you've got to prepare for that. And you've got to be having frank, upfront conversations and agreements that people are honoring. That's the whole thinking, is that people would come together, make agreements to keep themselves and people in the pods safe. Yeah. And then if you do that, you can bring two pods together for a Thanksgiving dinner or for a Christmas dinner.
Yeah, we're talking about, and that's coming up is Christmas, but it's really a challenge to get people to be in agreement like that. So this is where I want to just check in with you, Katie, because as Dr. or let me say Susan today, Susan mentioned that, you know, this is affecting children and sometimes adults. We're not having these conversations with children. We're just hoping maybe that they don't think about it or hear about it, but they watch the news, they listen to the TV, they're hearing their teachers talk about this, they're hearing others talk about it. How do we help with this? How do we help our children, which in turn will help us?
Well, I think it's a really good point, and it's an important issue. Children are really being affected, and I think that was a great example, Susan, you brought up about hearing children will teach. We can learn from children when they start talking about these kinds of things. It shows how they are being impacted. So I think one of the things that's very important is that we do limit the amount of exposure that they have to news and social media and other adult conversations. You know, we think, oh, the kids are fine and they don't hear all that and they're not listening. Oh, they are listening and they pick up on it and they are impacted. So children do need to be protected. That doesn't mean that we don't have any conversations with them. What it means is we don't have adult conversations with them about things that are scary or overwhelming and that they don't need to worry about. And that we talk to them in small doses about what we're doing to stay safe and basic information. They know we're in a pandemic, what that is, and that there are ways that we can stay safe. And as parents and guardians, we will ensure their safety. And that's our responsibility, and we love them and we'll take care of them. So those are really important considerations, because children need to feel safe and they need to hear that from their parents and guardians. So
Yeah.
I would say that's really important. And then the other piece about that is I think we need to take care of ourselves. So if we are not taking care of ourselves and we are overwhelmed by the news and watching too much of that, and we are stressed out and are not eating right or sleeping right or taking health precautions, then we're going to put ourselves in a vulnerable situation that we can't really care well for ourselves, more even less than for our children. So I think it's really important that we do practice self-care, we take care of ourselves, we take care of our children, and that we do stay tuned into the needs of our children. And sometimes our kids do need help with that, that's outside of what we can do. So it's okay to reach out and get professional help. There's nothing wrong with calling and getting some help. If your child, Dr. Verholden mentioned your child has a rash or something, people are asking about that. We reach out to medical professionals for those concerns. So if our child is having emotional concerns or struggles or signs of depression or anxiety, or ourselves, that please reach out for help, because it's part of our health care. And
Yeah.
I always like to promote anti-stigma about mental illness, because 1 in 4 people at some time in their life have mental health struggles. So it's quite common, and it's part of being human. So
Yeah.
it's okay to reach out and get help, and I want to encourage people to do that when it's needed.
Yeah, and when you talk about children, you just hit all of Susan Wolford, Dr. Susan Wolford's hot buttons, because she's a pediatrician right there at U of M Hospital. And I was thinking, and I want to ask Suzanne Cooper to get ready to unmic, because I've got a question for her with respect to testing. But in your experience, Susan, at the hospital, how are parents, or are you working with parents to talk to their children about the importance of getting tested? Because that's the adult conversation, right? And Katie just told us we need to be careful with that. So what are you saying to parents about how to talk to their children about getting these tests?
So I think that parents are familiar with being able to talk to their children about doing things to stay healthy, right? Because they have to talk them into immunizations. And after a certain age, that is a conversation. And so they talk to them about the fact that we do this in order to stay healthy. We do this in order to help keep other people healthy. And just last week, I had a little one who that was all that swayed her, because she didn't want to have it. Was a flu vaccine that she needed to get. She didn't want to get it, but mom was able to persuade her that we do this because there are other children who are sick and cannot get that vaccine. So you need to get it to help keep them safe. And they were able to do that. So I think that we can have the conversations with children that all of these factors, getting tested so that we don't spread it to others, wearing the mask and keeping it on so that we don't spread it to others, and keeping socially distant so that we don't spread it to others. So I think that it's definitely possible for parents to share this with children in a way without scaring them, but engaging them and being part of the solution.
Well, Dr. Wolford, I think I'm gonna have to take you along on some of these trips that these events that we had, where I see these parents really struggling, and sometimes it doesn't work. They have to come. I will come back next time. But I recognizing how important it is, I wanted Suzanne Cooper, who is really working on the ground here to make sure we have available testing sites, just to touch on, because we're gonna have more conversation about this in a little bit, Suzanne. But I wanted you to touch on the fact that there is availability at the testing sites for children.
That's correct, Yvonne. We definitely have the availability of testing for children. The 3 community sites are available for that testing. And again, they accommodate everyone. So that is available.
Okay, thank you. So we're gonna delve into the testing sites a little bit more later, but at that point, so parents, as you're thinking about it, and even all of you that are watching, community health workers, wherever you are in your station of reaching out to community, it help us to really share a message that even though it may be uncomfortable, that it's really important. So the world of the epidemiologist now, the Debbie epidemiologist now. Let me ask you to talk about this with us in that way, just in a common way. We hear so much on the radio and on TV and reading in the newspaper about these trends, and even sometimes we hear all these numbers. It's hard to make sense out of them for what we should do in our everyday life and how we should understand it.
Yeah, so the simplest way I like to explain this to people is the more people come in contact with other people, the more spread we're going to get in the community. And that's what we're seeing. It's almost unavoidable, right? Even if people are honoring all of the protocols, the more people that we have coming in contact with one another, the more spread we're going to get in community. Now, honoring those protocols severely decreases the likelihood, greatly, tremendously decreases the likelihood that even if you were to come in contact with somebody who was positive, even if they didn't know it, that you would become infected. So there is great power in prevention, wearing your mask, practicing social distancing, keeping your hands clean, keeping your hands out of your face. All of those things help. But anytime we see more people coming together, and then we've got the basics. If they're indoors, the risk is even greater. So there are things that we can do, but what we're seeing is a function of people coming together. We saw schools reopening, we saw businesses reopening, and even some of our best laid plans. Until we have a safe vaccine that's ready for community-wide distribution, the best thing that we can do right now is limit the amount of contact that we have with others, because we've got both pre-symptomatic and asymptomatic carriers. We've got people who have the virus who might become very ill from it. They just don't know yet because they haven't shown symptoms. And even before people start to show symptoms, they still have the ability to pass it on to others. And then there are some among us, and we're still trying to understand why, who will get the virus and be virtually unaffected. They won't really know. The symptoms that they have will be so minor that they might not even identify them as COVID symptoms. They might simply be a little bit tired, might have a scratchy throat for a day or two, or maybe have no symptoms at all. But those people are still able to spread the virus to others. So really limiting contact and honoring the protocols is the best thing we can do, because the more we come in contact with one another, the more the more cases we're going to see in our community. And that's just what we're seeing. And many of us are on post. My great colleague, Rick Sadler, who's looking at the data in partnership with our great collaborators at the Genesee County Health Department to see what is the impact of all of the travel and all of the coming together that we know happened on Thanksgiving. And it's not too late. This is not a predetermined or predestined outcome for us. If we all start doing our part right now, we can turn the tides. The same way the trends went up as we all started to re-engage and become more relaxed about wearing our mask or, washing our hands. If we just simply put those things back in, we can literally go back to the numbers that we had in July when we, then made the decision to start to re-engage. So this is not a done deal. And a lot of it is in our hands.
Dr. Deborah, I think that's a really good point, because with all that's going on at times, and I've talked to a lot of people, and I sit here in my house sometimes, it feels somewhat hopeless. If when we take all of our titles off and our dignified way of expressing things, you sit in your home and you're really feeling like, man, we're 38 weeks into this now. We started this webinar, thought it would be 2 weeks and we'd be done. And we're getting calls and saying, keep going, keep going. And then you're talking about the president saying in January, we're going to have another. This can get to be very overwhelming. So we just want to make sure we're offering to you information that can help us get through this season. I want to thank the panel that sat with me at the round table today. Appreciate you so much. And I want to say to those of you that are listening, this is an opportunity for you to put some questions in the queue. I see they're starting to come in. I understand that we're live on YouTube right now, and you can share this with your YouTube family or your Facebook family. Let me get it right, Doc. The Facebook family. And let's just get the word out that this is important information. You have the ability to make a difference individually that can make a difference collectively. So again, thank you, panel. We're going to move into some of the more specific discussions today. Dr. Deb, again, you're up first. You're up first because you're the epi lady, the epi doctor. Okay, I'm not going to ask you to write me a prescription, but tell me about what all of these numbers and these shifts mean in more detail.
I will. And since we still have our panelists on, somebody asked in the queue, is it still a good idea to go outside? And the three things that we didn't really say is it's really important that people do what they can to boost their immune systems. So simple things like, and I just give people the three basics. Sleep, getting sleep every night. Sleep is where your body restores itself. Sleep is a leading indicator for well-being. It's your chance to recharge, refuel, and it's your body's way to kind of get itself back together and get ready for the next day. And if you are sleep deprived, it's a cumulative thing. If you go many, many nights without sleep, you'll start to wear thin. So I really encourage people to sleep. You know what your pre-COVID sleep habits were. If you had bad habits, then take it on as something you really want to practice. And people say, well, how much sleep should I get? It varies per person. I personally recommend that people try to get about 6 hours at least of sleep every night. And that might be a goal for some people. For some people, they say, I'm good with 5.5. Whatever that is for you, just make sure you get sleep. Make sure you get the healthiest diet that you can afford. High in fruits and vegetables and whole foods, and high in nutrient dense foods. Why? Because those are the things that boost your immune system. And move your arms and legs 30 minutes every day. So is it a good idea to go outside? Absolutely. You get that sun, that sunlight helps your body to metabolize vitamin D. It helps with mood. It helps with you getting that 30 minutes of exercise in every day. It is a good idea. In Michigan, it's cold now. So make sure you got your coat on. If it's snow, make sure you got your boots on or your non-slip shoes and all that other stuff. So it's about people being safe. But I absolutely think going outside, if you are dressed appropriately for the weather, is a great idea. I just wanted to answer that because somebody put it up.
So let me go back, because you went into that Dr. Epidemiologist mode, and you said dense foods,
Nutrient dense.
nutrient dense. What do you mean by that?
Look on the back of your food. If it has no label, it's probably good. Like there's no label on an apple. There's no
Okay.
label on an orange. There's no label on a piece of fish, right? Those are nutrient dense foods. All the foods that you have that have labels, look on the back of them. Look on the back of your bag of chips. And what you will find is sodium content, fat, saturated fats, and all those other things. What you won't find is a whole lot of vitamins. So when I say nutrient rich, I'm talking about foods that have a lot of good stuff in them, a lot of vitamins, a lot of minerals, healthy fats, low in sodium, and typically those tend to be the foods oftentimes that don't have a label on them.
Okay.
Right.
Thanks.
Yeah. And I'm
Thanks.
sure Dr. Wolford could maybe even add to that, but foods with lots of vitamins and nutrients in them, lean meats, whole foods, fruits, and vegetables.
I'm just going to say amen, amen, amen. Absolutely.
Yep. Yep. All right. So I'm going to just move on and be real quick and say we've created something. I want to acknowledge our fabulous team at our Flint Center for Health Equity Solutions. That includes Mary Catherine Crawford, who's at the forefront of this. She's a Flint native and is interested in making sure that our policymakers are supported. So I know, Yvonne, you helped and chimed in on this. We will now be distributing each week a Genesee County and Flint Health Equity brief related to COVID-19. We've got, again, our fabulous partners at the Genesee Health Department, Flint's own native geographer, Dr. Rick Sadler, and Dr. Heatherlyn Uphold, who works with us to make sure that best practices are disseminated and implemented throughout our community. And so this is the brief that we sent out today. And the snapshot is, as of December 4th, we know that the holiday gatherings tend to worsen COVID spread and burden our systems and threaten the progress that we've made on narrowing and eliminating those racial disparities. And to reiterate, in March, African Americans were in Flint and Genesee County were more than 7 times likely than their white counterparts to contract COVID. In between July and October, we saw a full elimination of that disparity. The disparity still has been managed in November, but we're starting to trend in the wrong direction. We're seeing greater increases in COVID cases in African Americans. And so we still are not in a sort of pants on fire, sound the alarm mode. But if those trends continue, what is likely is we're going to see reemergence and an undoing of all of the progress that we made. So I just really encourage people now more than ever, again, going back to that notion of safe social pods, and I'll show you what that looks like again. Please do take advantage of the barrier-free testing that we have in community. And we're imploring and begging our policymakers to do the advocacy work for us to get the additional resources and the funding that we need to reinforce and strengthen the capacity of our local public health systems, of our economic system, of our elected officials, of our healthcare system to continue to meet the needs of our community. And of course, we really do encourage these, community-wide interventions that include things like support for small businesses. And I know Eric Andrzejczyk and others are going to talk about that. So just a quick recap. Next slide, please. On social pods and what's happening across the states. Across the state, we are still not in full reopening. People know that. The schools have closed. Most of the colleges and universities are online. Many workplaces have gone to modified operations. Notice the things that are open. We really are trying to keep some semblance of order for people. So you are able to go to restaurants, but you're not able to dine in. And I'm seeing now people are trying to be creative and create outdoor seating and other things like that. And you do have the ability to have small household gatherings and small outdoor gatherings. Related to the social pods, I just want to recap a couple of key points. It's important that if you create a social pod, that everybody agree exactly up front who's in the pod, discuss how the people who are vulnerable to COVID within that pod will be treated and how you will work specifically to keep them safe. That includes seniors, people with pre-existing health conditions, people who are already have any kind of issues that might suppress their immune system. And that includes things like asthma. That includes things like diabetes. If somebody has another condition like HIV that already has them be immunosuppressed, those people are at elevated risk for bad outcomes. You need to agree on how all the members of the pod will limit risk. Again, the whole point is you're coming together. You're discussing and laying out what are going to be the rules of engagement for our pod. And people need to make a pledge to be truthful, because the power of this model is if people are actually sharing and then honoring the things that they agree to do. Spend as much time as outdoors as possible, even within the pod. If you can spend time outdoors is a great thing to do. And then communicate immediately. And if anybody in the pod has a known exposure, they should immediately go into self-quarantine. Shouldn't be socializing outside of the pod. A pod can be no more than 10 people or 2 households. If it gets bigger than that, it becomes unwieldy and it kind of violates the protection that these notions of social pods will provide. This is all available through our wonderful state governor's office at michigan.gov/coronavirus. I encourage people to go there, download this document for yourself, share it with others. If people start creating these social pods now, they'll be well poised to be able to have 1 or 2 households come together at Christmas time and have it look a little bit different and be a lot safer potentially than it was on Thanksgiving. You're being brilliant on mute, Yvonne.
I'm being brilliant on mute. Thank you so much, Dr. Deborah. I get involved in the conversation, and I'm thinking about what this means, and what it brings to me to mind is the next piece we're going to talk about when you talk about these safety measures. And Suzanne Kupel, who is at the health department, is really, really at the forefront of helping us here in this community be sure that we can do those things necessary to stay safe. And one of those that she's talked about every week are the pods, are the testing sites. And because we've heard you, she's going to respond to some really important questions that you've raised as a result of that. So Suzanne, I want to ask you just to come on now and help us understand with the testing sites, give us those updates from the feedback. There are some questions that came forward, but you're just this is in your brain now. You just kind of tell us all about it. So please help us to understand the things that you and others have done in the background to improve what's happening at the testing sites. Suzanne, I think you need to unmute. Oh, we didn't lose her.
Hi, everyone. I just wanted to
there you
start
go.
by giving you an update on the positivity rate, because I think that's important, that we've gone from 14.8% to 15.2%. So we are still headed in an upward direction for the number of cases and the community spread that we're seeing. And to recognize that this positivity rate is reflective of the people who are going to get COVID-19 testing and how many of them are testing positive for COVID-19. And that is the reason why testing is important. So to talk about what's being done to improve the testing process, last week I told you that there were site visits that were happening with the 3 community testing sites. We know that those sites are getting more use. There are challenges with getting appointments, and again, there's just higher volume of folks that are going to get tested. So we know that the Macedonia site is now going to have a larger footprint in the building, meaning that there'll be more space for people to be able to go and comfortably wait for their testing timeframe, more opportunity for social distancing, and hopefully fewer physical barriers for those that might have a disability. So there's additional signage that's being added. We know that our colleagues at the Greater Flint Health Coalition are providing some additional referral services that are a part of that process. So we do want to make sure everyone knows they've added signage to remind everyone that those services are available when they're at the testing location. So those are some of the things that are being done right now to address those concerns. The other thing, again, with the wait lines, again, making sure that there's availability in the schedule. And I'm going to talk a little bit more about what are called pop-up testing sites in a minute, but we're making sure that we have enough information available and enough space available for those to get tested who need to be tested. I want to make sure that everyone's very much aware of the fact that when you go for your COVID-19 test, you are not likely to get a test result so it'll be within a 72-hour period. But if you go and get tested, you can't call the helpline 2 or 3 hours later because they're not going to have a test result. And when folks do that, it then creates a bottleneck where people can't get the information who need it, who have been waiting 72 hours in order to get their test results. So I do want to remind everyone that if you go and you get tested, that you wait 72 hours before you call that helpline in order to get information about your test result. So want to make sure that you are aware of that. Sharonda Grigsby, my colleague from MDHHS, and I are always available if someone has an issue or a concern and they want to raise it. You can contact us through the Genesee County Health Department's website with any information that you'd like to share about concerns about these testing sites or any of the testing sites that are in Genesee County. I want you all to know that we are monitoring carefully the numbers of people that are going and asking for those tests. And when there is high volume and the need for additional testing, we are working with our colleagues at the state and HANU, the company that's doing the management of the 3 community testing sites, to provide additional locations where folks can get tested. So we are working on adding a couple of additional what we call pop-up testing locations. And as soon as we've got those plans in place, I'll be sharing information about them as well. can I also share a couple of things, because you've been talking about planning for the future and how people are feeling. And I want you all to know that we at the Genesee County Health Department are very hard at work in partnership with our Emergency Operations Center in the Sheriff's Department, with school partners and other community collaborative partners, preparing for when we do have the access to vaccine for COVID-19. I do want you all to know that that work is taking place right now. We do anticipate getting the first round of vaccine very soon, and that will be for those frontline healthcare workers and EMS. So that is in the works, and we'll be sharing more information about that. There was a question in the queue about the safety and other information about these first rounds of vaccines and when essential workers might be a part of that process. The CDC has come up with a tiered process about who has priority for vaccination. And as we move forward and those tiers are being addressed, we'll give you lots of additional information about the vaccine, what we know about it, its safety, efficacy, and other bits of information that will be important for you in your decision making.
Thank you, Suzanne. The other quick thing, we're going to spend some time in the coming weeks talking about this in addition to what you said, but we do want people to know that there's still some guidance on quarantine and isolation, and they can check your website at the health department to know more about that, but it is something we should pay attention to.
So again, it's really important that if you go and you know you've been exposed to someone who has been tested positive for COVID-19, that you wait a few days before you go to get your test result. It takes time for your body to produce a response that would be captured in that test. But it's important that you stay at home. If you are not sick, but you're questioning whether or not you've been exposed and might be exposed to COVID-19, again, if you're questioning that, that's quarantine. You want to stay at home and limit your exposures, and this document shares a little bit more about that, and it is posted on our website. But we don't want you going about and again, spreading the virus. If you have symptoms, it's critically important, again, that you are staying at home and that you are not going out unless you need the care of a healthcare professional, that you are staying at home and you are taking care of yourself. What's most important for everyone on this call to know is that you should be monitoring for signs and symptoms of COVID-19 if you've had that exposure, or even if you have signs and symptoms, at least twice a day, taking your temperature, making sure that you are monitoring your health status. And that's the critical thing that we want everyone to remember.
Thank you so much, Suzanne. And I want us to remember that, again, this is available on the website. We're going to be talking about this every week, and there's more to come. This is going to challenge my skills here today because we've got a lot to cover and only a few more minutes left. We've got some late breaking news we want to bring to you. Moses Bingham is on the line on the webinar today with some really important news about a grant program that's available for small businesses. And then we're going to hear from another very important and new guest from the chamber. So Moses, if you could give us some insights, and then I want to be upfront and ask you to prepare to come back and be with us again so we can get into more details about this upcoming program.
Yes, for sure. Thank you, Miss Yvonne, and thank you for everyone who's been so diligent over the number of weeks that we've been able to talk about this coronavirus and talk about, how to be safe and how to navigate during this time of pandemic. But real quick, fast and furious, I serve as the Director of Special Projects and Initiatives. You've seen me before where we talked about $2.5 million coming from the federal government by way of the state of Michigan and MPHI to help us overcome some of the challenges. And as I serve as one of the staff members on the Greater Flint Corona Task Force on Racial Inequalities, we work with a lot of different sectors and a lot of different community members to talk about, what it is that we can do to invest and provide interventions to overcome these challenges. And so for small businesses, particularly African American and Latinx, we've worked with Metro Community Development to provide the Genesee County Minority Business Recovery Grant Program. And so you see the program highlights here for Genesee, for any business, small business in Genesee County that are African-American led or Latinx. You could get reimbursed for any of your PPE expenses, equipment, or things related to the closures regarding this pandemic. And so we have a deadline in which you should apply, which is December 15th, and monies are still available. And so we want everyone to apply and apply and apply so that you can receive these fundings as long as they are eligible. And the span of window is from October 1 all the way up to December 15th, and which are eligible expenses in which you could receive support. And so there's $250,000 available, and anywhere from 5,000 on up is at your disposal as long as you go through the process. And so just in summation, applications are due the 15th, but you do not have to wait until then. We're processing stuff right now. So apply soon and early so that we can get you in the queue, because once the dollars are gone, they are gone. And you can do that at metrogrants.com.
Thank you, Moses. We want to be sure to get that in late breaking, but it's quick. We'll talk about it a little bit more next week. Again, just pay attention to this date. Go ahead, Moses.
Yep. And one other thing, we have Eric on from the Chamber of Commerce, and we work with that group to ensure that dollars are getting out to the community. They have some breaking news as well. And so a lot of work by way of the Community Foundation connecting with a lot of different sectors to ensure that we get resources to our community.
Thank you. And that was a good segue, because Eric Anderchuk, who is a new guest with us today, but is from the Flint Genesee Chamber, the Director of Grants and Development. So Eric, we want to give you a little bit of time here to tell us about this program for small businesses.
Thank you, everyone. Thank you for allowing me to come and promote our grant program coming up. With all of the various grant programs that are out there right now for small businesses, we want to make sure that we promote this one as well. There you see on the screen is our Moving Flint Forward small business grant program page, which is at our website at www.flintgenesee.org/Moving Flint Forward. You can see that there's lots of information there that you can see where to apply, the grant criteria, and frequently asked questions about different eligibility requirements and what can be used for funding. If you would go to the next slide, thank you. Some of our program highlights are that we are giving out grants up to $10,000 for small businesses located in the city of Flint. And we define a small business as 25 employees or less. We have a total of $150,000 to grant out through this program. And so some of the acceptable uses of this funding, this isn't a direct COVID relief grant program, but in providing these grant dollars, this is an indirect way to support COVID relief for small businesses. As we know, the economic crisis that has kind of been created due to this pandemic is also very significant. But with our use of funds, you can use this for business growth expenses, for expanding your business, repairs to your facilities. If you need to purchase inventory or special equipment that will allow you to boost your business in any kind of way, facade improvements, all kinds of different things that we are looking to hear some exciting projects on how to boost small businesses in the city of Flint. Additionally, GHAM has earmarked 10 of the grants for minority-owned businesses as defined by race and ethnicity. So we want to make sure that we have a diverse grantee pool of those receiving our funds. We want to make sure that our minority-owned business brothers and sisters have access to capital as well, as we've learned that several folks have not been able to reach this capital due to the disparities that have been created. And so we want to make sure that we have at least 3/4 of our grants will be for minority-owned businesses. In addition to the grant program, you're going to be required to engage in some cohort meetings to network with each other and receive some business growth training. And so we hope to support these businesses by teaching them how to maybe digitize their goods and services when we are all at home working remotely. And so if they can do that service over the internet or provide delivery of that service or goods to you directly, that will be one of the things that we hope to teach our business owners. And you'll see here we have some important dates and contact information. So on Tuesday next week, on December 8th at 11 a.m., we're going to have a live info session webinar that will be similar to this. It will be hosted live on YouTube and Facebook, and then will be recorded and put on our website. And people can ask questions specifically about the program, and we'll give a much more detailed information on what we are able to do with this grant funding. The deadline for our grant program is December 30th by 5 p.m. You can access that on our website, which is listed right there. You can also print off the applications and mail them in directly to the office. The contact person for this program is Tracy Joseph, and that is her email address. If you have any questions, you can reach out to her, or you can reach out to me as well, and I'll be able to answer any questions you have on our program. So thank you again for letting me present this information to this group.
Yeah, Eric, before we move off this page, some of the folks are joining us by phone, and they can't necessarily see this contact information. So I just would like you to you give contact for Tracy Joseph. Can you give her email address out for those who are listening?
Yes, absolutely. Absolutely. So Tracy Joseph, her name is Tracy, T-R-A-C-Y, Joseph, J-O-S-E-F, or J-O-S-P-H. And her email address is tjoseph@flintandgenesee.org. And my contact information, which is a long last name, I apologize, is EANDREYCHUK@flintandgenesee.org. Thank you.
Yeah, Eric, thank you so much. I appreciate your smile. I struggled. I want to make sure we got your name right. So Dr. Deborah practiced with me before just to make sure we got it right. So thank you for sharing that with us. And I know people may be asking, so why are we talking about these grant programs on a coronavirus webinar? Well, as you mentioned, Eric, so appropriately, we've seen, and again, our epidemiologist, Dr. Deborah, has told us about these inequities. And the coronavirus has really shown us about this disparate inequity, even in our business sector. And so for us to have this opportunity to raise this as a platform for people to know that their small businesses, particularly minority businesses, can get that support, it does help us to address the impact of Corona in our economic setting. So we appreciate you for that, for sharing that, and look forward to you coming back and talking to us a little bit more about it. I did move a bit past our city and our state because I want to be sure we got these two programs, because there are some timelines here, December 15th and December 30th. So pay attention to those, and let's get some applications in for these dollars. I want to go back quickly to the city of Flint. And I know I'm challenging my team here. The city of Flint, Billy Mitchell. Billy Mitchell is here with us. Billy, tell us a little bit about what that update is for the city.
Yes, good afternoon, everyone. And so I wanted to just give you a couple of more updates. And so recently, December 2nd, we relaunched our water payment assistance program. And so for that program, residents can apply online at cityofflint.com. They can get $75 per month for 3 months on their water utility account. All you have to do is go to cityofflint.com. You can find all the instructions there as far as qualifications and what you need to do to be eligible for the program. If you have any questions, you can always call me, 810-610-3305. We also just have our regular updates as far as opt-in for pipeline replacement. You can go to cityofflint.com. You can't come to the building anymore because City Hall is closed, but you can reach out to me either through email at B as in boy, Mitchell, MITCHELL, at cityofflint.com, or you can call me 810-610-3305, and I can help you with any questions you have about your opt-in form to get your pipes checked. And then our filters, because we are closed to the public, you can still come to City Hall to our walk-up window. You can get your filters, you can get your water test kits, and you can even get masks. And so the walk-up window is open from 8 a.m. until 4 p.m. Monday through Friday. It's the same routine. You just call the 810-410-2020 number, and we'll bag up your filters. We'll take them over to customer service, and they'll hand them to you once you walk up to the window. And that is all we have as far as updates.
Thank you so much, Billy. It's good to know that you're still on the job, even though you're not physically at City Hall. You're making sure this important information is available to our community. So please, let's continue to get our water filters. We know holidays coming up. We're looking forward to Christmas, and we're going to talk to you a little bit more about how to prepare. So as we're preparing for these upcoming events, Gary Jones, Gary is here from the state, and I know he has a lot to share with us. Gary, so what are those key things you want us to know today?
Yeah, try to be as brief as I possibly can. I know we're running low on time here. So just beginning with the numbers, total confirmed cases of COVID statewide are now at 380,343. Total COVID-19 deaths, we have surpassed 9,000. We are at 9,580. And total of recovered COVID-19 cases as of November 25th are 165,269. Reminding everyone that recovered is defined as the number of persons with the confirmed COVID-19 diagnosis who are alive 30 days post-onset. So there was a recent announcement yesterday that the governor secured an extension of the Michigan National Guard through March 31st of 2021 to assist with COVID-19. So in anticipation of the rapid vaccine approvals from the FDA, Michigan will look to the National Guard to provide logistical support and transportation support to help distribute the vaccines. Since the COVID-19 pandemic beginning, our Michigan National Guard members have helped distribute more than 14 million pounds of food at food banks, delivered tests and protective equipment across the state, and assisted with testing more than 200,000 Michiganders for COVID-19. Also recently, the governor made an announcement about the Racial Disparities Task Force releasing an interim report showing significant progress in protecting communities of color from the spread of COVID-19. So actually, I want to take a little bit of time just to thank Dr. Verhoeven specifically for her work on this task force and our contributions to this interim report that detailed the significant progress that we made in protecting communities of color from the spread of COVID-19. The task force interim report details a number of actions the state has taken to protect communities of colors, frontline workers, small businesses as well. And lastly, the governor recently wrote a letter to legislative leadership asking for passage of a $100 million Michigan COVID relief plan. It's crucial for us to come together now to pass a targeted state-based economic stimulus plan of up to $100 million that will provide direct financial support to families and small businesses that have been hit the hardest by the pandemic, and also to pass a permanent extension of unemployment benefits. And if we don't take bipartisan action now, in order to do so, thousands of Michiganders could lose benefits right after the holidays. And also, we just need to work together on, passing this permanent extension on unemployment benefits. And lastly, passing legislation to protect public health. This legislation would be to require masks in public. Of course, we have it now under the epidemic order, but we recently received bipartisan support for codifying the mask order that's inside of that epidemic order in order to greatly improve compliance, assist law enforcement, and help slow the spread of COVID-19 in the state of Michigan. And as a reminder, michigan.gov/coronavirus, still the best website to keep up with updates. It is hard to talk fast. I am not a fast
I
talker,
know, Gary, thank you. Thank you, Gary. I know it's a lot, but so please check out his website and check out and get on his list. In the interest of us closing out in a way that rounds us out, I'm going to ask Dr. Susan Wolford. We wanted you to answer a specific question, but I want to just say to you, there are questions in the queue. Please continue to put those questions in the queue. We'll answer them for you. Next week, we're going to have some more vaccine insights. You see this beautiful picture of Dr. Wolford. She's going to come back next week and talk to us about some vaccine insights. The question was asked about safety and other things. So We appreciate you joining us every Friday for this Flint Community webinar on coronavirus. Please continue to get your CEUs. And we're excited to say we've had over 200 people request CEUs as a result of 200 requests for CEUs from this webinar. And we're doing our best to get those to you. So please continue to chime in. Join us next week. We'll be right here. You can like us on our Facebook, subscribe on our Healthy Flint YouTube channel, and send us those questions in Healthy Flint info at healthyflint.org, or call us at 810-835-2135, 810-835-2130. The pop-up evaluation will come to you shortly after the webinar, and we look forward to you being here with us next week on December 11th for the Flint Community webinar on coronavirus. Thank you so much for joining us, and we hope this information shared today was helpful to you. We'll look forward again to seeing you next week, December 11th, for this webinar.